A major change happening this weekend in the COVID realm.
In just a matter of days, masks will no longer be required in New York healthcare facilities. However, it is up to the individual facility to make an independent decision to mask up or not. This just decided by the State Department of Health, ultimately allowing the mask mandate to expire. The state is asking healthcare facilities to follow guidelines established by the CDC and come up with their own plans on masking for staff, patients, and visitors. Acting State Health Commissioner Dr. James McDonald did note this does not mean the pandemic is over, emphasizing the importance of ongoing vaccination and booster efforts.
With that expiration determined by the state, it prompts the question as to how counties, hospitals, and private practice settings will adapt to this updated guidance.
Monroe County Public Health Commissioner Dr. Michael Mendoza joined leaders from the University of Rochester Medical Center and Rochester Regional Health this afternoon to discuss how this decision will affect operations on the local level. Dr. Mendoza says while the update is new, he says it will take some time for hospital systems and secondary healthcare settings to make their own decisions. He, as well as leaders from URMC and RRH, all say they support masking as a tool to best combat the spread of COVID. Dr. Mendoza adds different areas of a hospital can vary in terms of risk level, which he says will also be an important factor in the decision-making process.
We do have some experience to borrow from. But that being said, the bottom line is that we don't want to withdraw any precautions prematurely. And so we'll be looking very closely. We'll want to look at all of the different hospital settings. The risk in the dialysis unit is going to be very different than the risk in the cafeteria. So we've just got to look at all of the settings across all of the settings of care across our hospital systems and long-term care. And, we want to make that decision thoughtfully with the best interests of our patients and community in mind.
Now, as for the COVID vaccine mandate on healthcare workers in New York State, recently struck down by a judge, it was later appealed by the state. Today, URMC and Rochester Regional both say they support COVID vaccinations for employees and say neither hospital system at this point in time are rehiring unvaccinated workers. We will have much more coming up on News 8 at 5 and 6 from our local health leaders.